Hi, I'm Aisling, a fourth year psychology student, and today I will be talking about schizophrenia. But first, how many of you know somebody with celiac disease or autism? Well, both these disorders have a lifetime prevalence rate of roughly 1%, the same as schizophrenia. But because it is an invisible mental illness, people often have difficulty relating to it. The term itself causes confusion, as it literally means split mind. But contrary to popular beliefs, schizophrenia is not characterised by having multiple personalities. Now, let's talk about Tony. Tony had a difficult childhood and was placed into foster care at the age of 7. Despite graduating from college, he developed a substance abuse problem and was admitted to a psychiatric hospital at the age of 22. Tony eventually received a diagnosis of paranoid schizophrenia. But what is schizophrenia? Well, symptoms include delusions. Tony believed devices had been implanted in his head by police, who then used radio beams to overstimulate his brain. Hallucinations. Tony's voices told him he was under police surveillance and would eventually be killed. Disorganized speech. Grossly disorganized or catatonic behavior. And finally, negative symptoms. But what causes schizophrenia? In the past, an environmental factor, such as Tony's difficult upbringing, may have been the focus, or some internal biological factor. It was not until 1952 that cognitive theory was applied to schizophrenia, as previously it was believed to be a biological condition, only treatable by antipsychotic drugs. Attention. Schizophrenics have difficulty focusing their attention, which in extreme cases can make things like a simple conversation impossible, as sentences resemble little more than random strings of words. Whereas at the other extreme, this can result in sufferers being unable to break focus. Attribution. Schizophrenics tend to incorrectly attribute events to external rather than internal events. For example, interpreting signs of panic attack, such as sweating, as evidence you are in hell. These abnormal attribution processes interfere with recovery, as if patients think their voices are being imposed by an external source, they may feel treatment is pointless. Theory of mind. By age 5, most people understand that others have different thoughts than their own, something called theory of mind. This comes with the ability to guess what others are thinking and spot deception. Schizophrenics show deficits in this ability, so sufferers often end up isolating themselves due to suspicion and paranoia, which in turn maintains delusions and distress, as there is no opportunity to encounter evidence contradicting their beliefs. At the heart of the cognitive approach is the fact that individuals fully believe in their delusions and hallucinations. So Tony's doctors created a plan to help him evaluate his beliefs against objective standards. He worked with his therapist to gather evidence for and against his beliefs, while also coming up with alternative explanations. Tony was brought to an underground war bunker with no radio signal available. Therefore, Tony should not hear voices if his conviction that they came via radio beams was true. When he continued to have auditory hallucinations in the bunker, he was surprised. And although his delusions of persecution continued, he experienced significantly less distress. Tony's delusion that a police officer was hunting him was tested by arranging a meeting between them. The opportunity to ask questions greatly reduced his fears that there was a conspiracy to kill him, and although he still questioned the source of his beliefs, he doubted their power and truth. These behavioural experiments, combined with other strategies, including role-playing and social skills training, proved a valuable addition to Tony's treatment. An important observation, considering a large proportion of schizophrenics and antipsychotics continued to show symptoms. Tony had returned to university and had not relapsed on publication of his case study. So, let's recap. Today we talked about schizophrenia, a chronic mental disorder affecting roughly 1% of the population. Key symptoms include delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. 3 main theories have tried to explain the disorder: the environmental approach, the biological approach, and the psychological approach, which from a cognitive perspective explains symptoms on the basis of problems with attention, attribution, and theory of mind. Impossible to underestimate is the destigmatizing understanding a cognitive approach provides. By considering patients' beliefs as one possible interpretation of events, while also forming more functional explanations, the patient does not feel threatened and the focus is on distress reduction.
Created using Powtoon.